Gingival curettage is a specialized periodontal procedure designed to treat gum disease by carefully scraping the inner aspect of the diseased gingival wall within a periodontal pocket. This process removes ulcerated and hyperplastic pocket epithelium, as well as the adjacent zone of damaged connective tissue. The goal is to reach the firm, healthy part of the gingival corium. By targeting these diseased tissues, gingival curettage helps restore gum health and supports the healing process. This foundational understanding sets the stage for exploring why and how this procedure is performed in modern dental care. The main rationale behind gingival curettage is to remove chronically inflamed granulation tissue from the lateral wall of the periodontal pocket. This tissue is often filled with fibroblastic and angioblastic proliferations, chronic inflammation, dislodged calculus, and bacterial colonies. By eliminating these unhealthy tissues, the procedure helps reduce inflammation and supports the natural healing of the gums. Understanding this rationale is crucial for appreciating the clinical benefits and the science behind the technique. After gingival curettage, the gingival wall shrinks as the inflammatory infiltrate resolves and tissue fluid drains away. The exposed connective tissue begins to re-epithelialize, forming a new lamina propria, sulcular lining, and epithelial attachment. Over time, the microvascular quality of the tissue is restored, leading to healthier gums. This healing process is essential for the long-term success of periodontal therapy and highlights the importance of proper post-procedure care. There are several types of gingival curettage, each tailored to specific clinical needs. The standard gingival curettage focuses on removing inflamed soft tissue lateral to the pocket wall. Subgingival curettage is performed apical to the epithelial attachment, targeting deeper tissues. Inadvertent curettage may occur unintentionally during routine scaling and root planing. Additionally, surgical, chemical, ultrasonic, and laser methods offer alternative approaches, each with unique advantages and indications. Gingival curettage specifically targets the inflamed soft tissue on the lateral side of the periodontal pocket. This method is often used when the inflammation is moderate and localized, making it an effective choice for early intervention. By focusing on the lateral pocket wall, the procedure helps reduce pocket depth and supports the healing of surrounding tissues. Subgingival curettage is a more advanced technique performed below the epithelial attachment. This approach is used when deeper periodontal pockets are present, requiring removal of diseased tissue closer to the root surface. Subgingival curettage is particularly beneficial in cases where standard methods are insufficient, offering a more thorough cleaning and improved outcomes for advanced periodontal disease. Inadvertent curettage occurs unintentionally during routine dental procedures like scaling and root planing. While not the primary goal, this accidental removal of inflamed tissue can still provide therapeutic benefits. It highlights the interconnected nature of periodontal treatments and the importance of careful technique during all dental procedures. Beyond traditional mechanical curettage, other methods include surgical, chemical, ultrasonic, and laser approaches. Each offers unique benefits and may be selected based on the clinical scenario, patient needs, and the extent of periodontal disease. These alternative methods expand the toolkit for dental professionals, allowing for more personalized and effective care. Gingival curettage is indicated in several clinical situations. It is often part of new attachment therapy for moderately deep infrabony pockets, especially when closed surgery is advised. It can also be used as a non-definitive procedure to reduce inflammation before more extensive pocket elimination surgeries, such as flap procedures. Understanding these indications helps clinicians select the most appropriate treatment for each patient. In some cases, extensive periodontal surgery may be contraindicated due to patient age or systemic health complications. For these individuals, gingival curettage offers a less invasive alternative that can still provide significant therapeutic benefits. It is also useful during recall visits as a maintenance method for recurrent inflammation and pocket depth, especially after prior surgery. The basic technique for gingival curettage involves performing the procedure under local anesthesia. A selected curette is adapted with its cutting edge against the tissue, and the instrument is inserted to engage the inner pocket lining. Typically, a horizontal stroke is used, and the pocket wall may be supported by external finger pressure. This careful approach ensures effective removal of diseased tissue while minimizing trauma to healthy structures. In subgingival curettage, the technique involves a scooping motion to remove tissue between the pocket bottom and the alveolar crest. This method is particularly effective for deeper pockets, ensuring thorough removal of diseased tissue. The precision of this technique is essential for achieving optimal clinical outcomes and promoting healthy gum reattachment. The excisional new attachment procedure, or ENAP, is a definitive subgingival curettage technique. It involves making an internal bevel incision from the free gingival margin apically below the pocket base while preserving the interdental tissue. The excised tissue is carefully removed, the root surface is planed, and the wound edges are approximated to promote optimal healing and new attachment formation. Ultrasonic curettage utilizes high-frequency vibrations to disrupt tissue continuity, lift the epithelium, and alter fibroblast nuclei. This results in decreased inflammation and improved healing. The ultrasonic method is particularly useful for patients with moderate to advanced periodontal disease, offering a less invasive and efficient alternative to traditional mechanical curettage. Chemical curettage involves the use of caustic drugs, such as phenol or sodium sulfide, to remove diseased tissue. While this method can be effective, it is challenging to control the extent of tissue destruction, making it less commonly used. Careful selection and application are essential to minimize risks and ensure patient safety. Laser curettage targets both soft and hard tissues using focused light energy. The bactericidal and detoxification properties of lasers help remove the epithelial lining and improve healing, especially in moderate and inaccessible pockets. This advanced technique offers precise control and enhanced patient comfort, making it a valuable tool in modern periodontal therapy. Immediately after gingival curettage, a blood clot forms at the site, followed by hemorrhage and an increase in polymorphonuclear leukocytes, PMNLs, on the wound surface. This initial response is critical for protecting the wound and initiating the healing process. Rapid proliferation of granulation tissue soon follows, setting the stage for tissue regeneration. Within days of the procedure, granulation tissue rapidly proliferates, and sulcular restoration typically occurs within 2 to 7 days. This phase is marked by active tissue regeneration and the re-establishment of a healthy sulcular lining. Proper oral hygiene during this period is essential to support optimal healing and prevent complications. Immediately after curettage, the clinical appearance of the gingiva is typically hemorrhagic and bright red. This is a normal response to the procedure and reflects the increased blood flow and inflammatory response at the wound site. Patients should be reassured that this appearance is expected and will improve with time. 1 week after the procedure, the gingiva typically shows reduced height, an apical shift, and slightly reduced redness. These changes indicate the resolution of inflammation and the beginning of tissue maturation. Continued improvement is expected with proper oral hygiene and follow-up care. By 2 weeks post-procedure, and with proper oral hygiene, the gingiva usually returns to a normal appearance. This marks the completion of the healing process. With restored tissue health and function, patients can expect improved comfort and a significant reduction in periodontal pocket depth, highlighting the effectiveness of gingival curettage